What if I told you that the real reason your legs are swelling after 60 has very little to do with just getting older, and much more to do with one simple system in your body that's quietly slowing down, and that there is a safe, practical way to support it starting today? I know that sounds too simple. You're probably thinking, I've heard this before, doctor. I've tried the supplements. I've cut the salt. I've walked more. I've elevated my legs, and nothing really worked. And I hear that every single week. Many of my patients come to me after years of trying compression socks, special creams, water pills, low-sodium diets, and well-meaning advice from friends and family, only to feel frustrated, confused, and honestly exhausted. My name is Dr. Elena Morris, and I've been treating patients in their 60s and 70s for over 22 years. I'm a physician, but I'm also a woman who has watched my own mother struggle with leg swelling that made her shoes feel tight by noon and her ankles disappear by evening. Over the past 2 decades, I've helped thousands of older men and women reduce leg swelling by as much as 30 to 40%, not overnight, not magically, but measurably and safely, by addressing what's actually happening inside the aging body. Many of the people I see are doing everything right. They take their medications exactly as prescribed. They walk every day, even when it's uncomfortable. They watch their salt. They drink water. And yet, by late afternoon, their legs feel heavy, tight, and sore. Some tell me they avoid social outings because their shoes don't fit. Others say they stop traveling because sitting makes everything worse. I see the frustration, the money spent, the constant vigilance, checking ankles, pressing fingers into the skin to see if it leaves a dent. And I want you to know you're not failing. Your body is asking for support in a very specific way. Before we go any further, I'd love to know where you're watching from. Please take a moment and comment your country or city below. I read those comments personally, and it helps me understand the community I'm speaking to. And let me be very clear right now. This is not about replacing your medications. This is about supporting your body safely alongside the plan your doctor has already given you. Now, let's talk about what's actually happening inside your body after 60. As we age, several physiological changes occur that directly affect fluid movement in the legs. First, the calf muscles, often called the second heart, lose strength and efficiency. These muscles normally help pump blood and fluid back up toward the heart. When they weaken, fluid pools in the lower legs. Second, the valves inside the leg veins become less tight. Think of them like one-way doors that don't close as well anymore, allowing fluid to slip backward. Third, the lymphatic system, which is responsible for draining excess fluid and waste, becomes slower and less responsive with age. And fourth, many common medications, especially for blood pressure, pain, and diabetes, can subtly increase fluid retention. But here's what most people, including many healthcare providers, completely miss. Timing and movement patterns during the day matter just as much as what you eat or what pills you take. Even mild swelling, when it happens day after day, creates measurable negative effects over time. Skin changes, increased infection risk, stiffness, and reduced mobility. Let me tell you about Margaret. Margaret is 68 years old, and the first thing she said to me was, "Dr. Morris, I don't understand what I'm doing wrong." She was on her medication, walked 30 minutes every morning, tracked her blood pressure, and followed a low-sodium diet. Her husband was worried because by evening, her legs looked shiny and tight. When I asked her to walk me through a typical day, minute by minute, she mentioned something almost in passing. She did most of her sitting in the late morning and early afternoon, right after her walk. That was the hidden issue. She was doing the right things, but in the wrong order. We made a few simple changes, very specific ones. We adjusted her walking to 2 shorter sessions, 10 minutes in the morning and 10 minutes mid-afternoon. We added a hydration window, 12 ounces of room temperature water within 30 minutes of waking and another 8 ounces around 2 p.m. We introduced 5 minutes of ankle pumps and calf raises before sitting for more than 30 minutes. 2 weeks later, she called my office and her voice sounded lighter. After 1 month, her ankle circumference was down nearly an inch. She laughed and said, "I honestly thought you were a little crazy, doctor, but it worked." Before I teach you the method I use, let me explain the 3 most common mistakes I see every single week. Mistake number 1 is thinking swelling is only about salt. Salt matters, yes, but focusing only on salt is like blaming traffic on one red light. Mistake number 2 is sitting too long after movement, like watering a plant and then letting the soil harden so the water can't spread. And mistake number 3 is ignoring the lymphatic system entirely, even though it plays a huge role in fluid balance. Now let me introduce you to what I call the CALM method. CALM stands for circulation, activation, lymph flow, and maintenance. It works in 3 phases. Phase 1 happens in the morning within 30 minutes of waking. Drink 12 to 16 ounces of room temperature water and perform 3 minutes of gentle calf raises, slow and controlled. This activates circulation and signals the kidneys to balance fluid properly. Phase 2 happens midday. After any period of sitting longer than 30 minutes, do 60 seconds of ankle pumps and take a brief walk even just around the room. This keeps lymph moving. Phase 3 happens in the evening. Elevate your legs just above heart level for 15 minutes with slow breathing, allowing gravity-assisted drainage. Let me tell you about Robert, 72. He came to me exhausted, discouraged, and worried about his blood pressure numbers creeping up. He started with just one small change: midday movement breaks. 3 weeks later, his swelling was visibly reduced. His labs improved, and his doctor even adjusted one medication. He told me, "I feel genuinely different, lighter." Practically speaking, people ask me, how much? How often? Here's a simple rule. Move your ankles every 30 minutes, walk at least 20 minutes total per day, split into shorter sessions, and hydrate earlier in the day. Week 1, you'll notice less tightness. Week 2, less visible swelling. Weeks 3 to 4, improved comfort and mobility. Long-term, many patients tell me, "Doctor, I just feel better overall." Let me be absolutely clear about something critical. This is not a replacement for medical care. Do not stop your medications. Continue following your doctor's plan. If you have heart failure, kidney disease, sudden swelling, pain, or redness, you must consult your physician immediately. Finally, I want to share Helen's story. Helen is 75. She lived with leg swelling for nearly 20 years. She felt hopeless. She avoided mirrors. She cried in my office. We applied the CALM method consistently. 3 months later, she hugged me with tears in her eyes and said, "I wish someone had told me this years ago." I want to challenge you personally. Try this method for 14 days. Drink the water, do the movements, track how your legs feel and look. Comment your progress below. If you made it to the end, type CALM in the comments and tell me your biggest struggle. Share this with someone you love. Subscribe and turn on notifications. Small strategic changes, done consistently, create genuinely measurable results over time. This is Dr. Elena Morris, and I'll see you in the next video.